Welcome to our second Facebook Live. I'm Dr. Larry Seidman.
I'm Dr. Tiffany Meyer.
And I'm Dr. Alifiya Tyabji.
And we're the doctors of Nova Pediatrics. So welcome. Today, we'll be talking to you about some baby care basics. Thank you for coming to our second Facebook Live. We have a contest going on for Mother's Day, where you could put a picture of your child and you on our Facebook page, and then you can win a $50 gift certificate to Mike's Restaurant. So happy Mother's Day to all the mothers out there, and I leave you in good hands with Dr. Tyabji and Dr. Meyer.
As you can see, we are practicing our physical distancing. We're going to go ahead and now remove our masks since we are at least 6 feet apart. So thank you again for joining us.
Yes, thank you for joining us. So we'll talk a little bit about some common topics about newborns, and then we were going to leave it open to some questions. Dr. Tyabji, you want to start?
Sure. So just a little brief overview will be some of our topics of discussion today will be feeding, sleep, preventing sudden infant death syndrome, peeing, pooping, umbilical cord care, how to console your baby and what that means, diaper rash,
circumcision care.
Yep, and fever and car seat safety.
Yes. Great. So feeding is one of the biggest issues, obviously, right? One of the major important things to do is to feed your baby, of course, right? And parents always have lots of questions about feeding, and that's why we're here. That's why we're doing these things, because we want to help you get through these kind of these times when you're not really sure, are you doing things right? And so feeding, breast milk, of course, is best, and we do completely support breastfeeding, but it doesn't always completely work out, and many times parents need to supplement, and that's okay too. But we're here to kind of work through that. We have lactation consultants too that help you too.
Mm-hmm. And if your baby needs formula, that's still perfectly fine, and we can kind of guide you as to the best formula for your baby. But breast milk or formula is all the nutrition that your baby needs at the first 6 months of life.
And that's right. And we get a lot of questions from parents about water. Do I need to feed my baby water? Can I feed my baby water? Really, breast milk and formula have all the water that most young babies need. And so we really don't even recommend introducing water till about 6 months of age.
And that's usually about the age where we start recommending solid foods for your baby.
Right, that's correct.
So initially, your newborn will feed about every 1 to 3 hours in the first couple of weeks, and then we'll maybe space apart to about every 2 to 4 hours of feeding.
That's right. And if you're lucky, you'll get a 3 or 4 hour stretch at some point, maybe at night, but it doesn't. Every baby's different, so.
And especially with some babies, they may have their days and nights reversed in the first couple of weeks.
Absolutely.
Where a lot of babies will sleep during the day and stay awake at night.
And just think about when the baby's inside mom is active and moving around during the day, and that activity kind of rocks the baby to sleep. And then when she's sleeping at night and she's not moving, the baby's active and moving. So the babies take 6 to 8 weeks to kind of get that straightened out, their days and nights.
But it will happen eventually.
Eventually, yes.
And of course, more than just that, with feeding your baby, obviously, provides, good nutrition, but feeding your baby also gives you a chance to bond with your baby as well.
Absolutely. And that's that when parents ask me or talk to me about breastfeeding and things aren't necessarily going as well, you really want to kind of step back and see, well, it's okay if I supplement, because I'm still bonding with my baby, and I want that experience to be a positive one.
And that bonding, along with cuddling, good eye contact, talking with your baby, making, eye contact also helps with the development of your baby as well.
Absolutely. Singing to your baby, reading to your baby. It's never too early to start reading to babies, singing to babies, just talking to them. And, talking to them, if you want, you can talk in baby talk, but you can talk to them like you would talk to anybody else. So.
Well, especially, when they were inside of you, they've been listening that whole time.
Absolutely. And they know mom and dad's voice. They know their siblings' voice. They know voices by the time they come out.
And in that first few weeks, you're going to notice, as you are talking with your baby will, recognize you and, look at your face.
Absolutely. They'll turn to your voice. Absolutely.
And, sleep, as I mentioned earlier, can vary baby to baby. But newborns sleep about an average of 16 to 20 hours a day, about 1 to 2 hours at a time.
That's correct. And then as Dr. Alifiya said, the sleep really, their sleep cycle is off in the beginning, but it does straighten out.
Mm-hmm. And then, as your baby gets older, the total number of hours of sleep will decrease. So as some babies will do, hopefully yours will as well, then you might be able to get a good 4 to 5 hour stretch at night.
If you're lucky, yes.
Of your baby sleeping. And a lot of babies will start sleeping through the night, sometimes at about 4 months of age.
That's right. And, parents ask, a lot about, a lot of sleep questions. And, unfortunately, for the parents who don't have a baby who sleeps well, some babies really just miraculously are good sleepers. So it's not necessarily anything you're doing wrong. You may just not have a baby who's a great sleeper.
Mm-hmm. And then sometimes even by starting solid foods around 6 months of age, that sometimes will help with the baby being more satisfied, and will also help with the baby sleeping longer at night.
Absolutely. And remember, breast milk is best, but breast milk actually empties through the intestinal tract really quickly. So babies do wake up frequently because they're hungry, which is normal.
Mm-hmm. Very normal. And so kind of going along with sleep is we want to talk a little bit about something called sudden infant death syndrome, which stands for SIDS. And it's a very important topic, regarding safety of your baby.
And SIDS can be a very scary thing for parents. SIDS really is the death of an infant without any known cause. So, but there are definitely, we know, ways to prevent SIDS. And the number one important way is to have your baby sleeping on his or her back.
And, since the American Academy of Pediatrics implemented this back in 1992, we've definitely seen a significant, at least 50% in the last, in those first 10 years of a decline in SIDS. And as Dr. Meyer mentioned, the most important is having your baby sleep on their back in their own crib or bassinet.
Correct. And a couple other things with SIDS, they actually believe that risk factors can be smoking. So passive smoking, so trying not to have anybody smoke around the baby is another way to protect the baby. Pacifier use is actually, there's some studies that show that babies don't fall as deeply to sleep when they use pacifier. So it is okay for a baby to use a pacifier if he or she will take the pacifier. And one other thing is fans in the room. There are some studies that show fans circulating air in the room is another prevention for SIDS.
And it's perfectly safe to have your baby swaddled in a thin blanket. You just don't want to have any loose, bedding, thick blankets, stuffed animals in that crib or bassinet. Right.
Anything where the baby could get his or her face stuck up against
or suffocate.
Or suffocate. Yes, that's correct.
And so it's very important. That's one of the big, safety, for your newborn.
And one last thing about SIDS is there are studies, and this kind of goes along with the fans, that overheating. So you don't want to over bundle a newborn, a thin blanket, and the fans help circulate the air and prevent the overheating also.
So again, it's perfectly fine, for example, if you're feeding your baby in your bed, but as soon as, you're done feeding and you feel like you're going to be going to bed, then you want to place your baby in, his or her crib or bassinet. Right. And that crib or bassinet can be in your bedroom.
That's correct. And many times, the Academy of Pediatrics even recommends to keep the crib in the same room for the first 6 months with the parents, and then you can gradually move that crib into the baby's room.
Absolutely. And hopefully that will also help with the sleep training as well.
Absolutely.
So the next topic is bowel movements. So that first bowel movement that your newborn will pass is that very typical black, sticky, tarry stool, and that's called meconium. And that meconium will happen in the first few bowel movements. And that stool will, transition in those first few days, and eventually in that very typical, we become that typical yellow mustard color stool. Babies that are, primarily getting breast milk will have more of a typical seedy, loose, watery, almost like diarrhea stools, versus formula-fed babies, because breast milk is more easily digestible as compared to formula. So formula-fed babies will tend to have more of that thicker, pastier stool.
That's right. They have tried to, in recent years, put probiotics and prebiotics in formulas to kind of help make them a little more similar to breast milk. But typically the formula-fed stools are a little thicker or pastier. But you may also notice that they can be the looser stools too sometimes. And you would be surprised at how many questions we get about stools. It's a very common concern, so you're not alone worrying about babies' poops.
Yep, and we're used to looking at pictures.
Yes,
and
parents bring us lots of pictures.
Absolutely.
So colors, I get a lot of questions about colors of stool. Really, the color does not worry me. It can be yellow, orange, green, but blood. We do not want to see blood. So if you have any red stool or blood in the stool, definitely we want to know about that.
Or if your baby's constipated as well.
Sure.
But it also can be very normal for breastfed babies to even go up to a week without having a bowel movement. So as long as they're happy, comfortable, not fussy, and still feeding normally, that can be perfectly normal.
Right, and as long as the stools are coming out soft. And, you know, sorry to do analogies, but they typically say that the stool shouldn't be thicker or harder than toothpaste. So so if it's harder and it's thicker or balls, that's too hard. But toothpaste consistency is okay.
And yeah, we definitely don't want those rabbit pelt stools.
Right, correct.
And so initially your baby will, you know, poop a couple of times a day. And as your baby's, you know, taking more milk in, the frequency of pooping will definitely increase. Some babies, you know, will poop after every feed.
Absolutely. Many breastfed babies go 8 to 12 times a day, and they're little squirts, and I've seen them hit the wall. They come out explosive. And then a very common thing, which sometimes alarms parents, is at that 1 month of age, the stools slow down. So babies at about 1 month may only start pooping once a day when they were going several times a day beforehand, and that's normal. And babies really don't, as Dr. Tyabji said, babies do not need to poop every day. As long as they have lots of wet diapers, that's what's important.
Exactly. So I was going to actually mention that without, you know, monitoring wet diapers initially, you'll be doing that in the hospital. So you want at least 3 to 4 wet diapers in the first few days. And again, you're going to see an increase in frequency of that as well as your baby's taking in more milk. And that's one of the ways to monitor the hydration of your baby.
Correct. That's right. And then sometimes if a baby isn't well hydrated, you'll see some orangey crystals in that stool, in that urine, I'm sorry. And so that's something to let us know about if you ever see orange crystals in the urine or in the diaper.
Exactly. And that can happen many times. And again, it's nothing alarming, but just to, you know, kind of keep, if that does happen, that's just a sign where the baby is just kind of cleaning out their urinary system, and then to increase that milk, and you'll see that clear out pretty quickly.
That's correct.
So, you know, eventually your baby will be urinating at least 6 times in a 24-hour period. So if you're noticing your baby not feeding, if you start noticing significant decrease in wet diapers, making less than 3, for example, in a 24-hour period, that's something that you definitely want to call your pediatrician's office about.
Yeah. And then also kind of going on to umbilical cord care. So we get a lot of questions about babies' umbilical cords, and typically the umbilical cord, the stump that's left after the obstetrician ties off the cord, will dry up and fall off within 2 to 3 weeks. Sometimes a little sooner, sometimes a little later, but almost every baby is gone by a month of age. And we really frequently actually see some blood maybe before it comes off. It may be oozing, it may be kind of yellow and gooey. And I've had many parents describe an odor to me right before it comes off, and that's all normal. And I think what scares parents sometimes is seeing the blood, but a little bleeding before or after it comes off is very common.
Something that I recommend is if you do notice that, you know, ooziness or bleeding, you know, you can clean it with alcohol.
Sure.
That also helps it to keep it clean and drying it out. So again, the most important thing is you want to keep that area clean and dry. So you can give your baby sponge baths. Once that cord falls off and the belly button looks like it's healed is when you can start doing the submersion, you know, in the tub of water. And also kind of folding the top of the diaper down will also prevent, any urine from getting the umbilical cord wet and helping that umbilical cord dry out faster.
That's correct. And the hospitals are going to tell you that you don't necessarily need to keep it or to clean it with alcohol, but it is okay if you like to. Sorry.
And so you definitely want to call the pediatrician's office if you do notice any redness or swelling of the belly button, or you do notice any pus discharge coming from the belly button.
Excuse me.
It's okay.
Yes. No, that's very, umbilical cord questions are very common.
And then the next topic is, crying baby, which is very normal. That's the way that your baby's going to communicate with you, telling you what their wants and needs are. So, for example, if they're cold, if they're hungry, if they have a dirty diaper, or if they're not feeling well.
Sure, absolutely. And, babies have different types of cries, and usually it takes about 3 weeks before parents can tell the difference between the types of cries.
But, you're never going to spoil your baby. So if you want to hold your baby as long as often as possible is perfectly fine. Again, that's going to be another way for you to bond with your baby.
Absolutely. Crying is, parents worry about crying, but it really is the baby's way to communicate. So just, be in tune to your baby. And if your baby's crying and you want to pick them up, that's perfectly fine. And please don't feel guilty if your parent is a parent, you need to use the bathroom and you have to put your baby in a safe spot to go to the bathroom and they're crying. So.
Absolutely. And you'll definitely get to know your baby within the first few weeks as to what that cry means. And most of the time, as soon as you respond to that, your baby will calm down and will soothe and will be consolable. However, if your baby's not consolable and is extremely fussy and you're not able to calm your baby down, within, a couple of hours, that might be an indication that there could be something going on. And you definitely would want to call your pediatrician's office to figure that out.
That's right. So a baby who cries constantly, nonstop for hours, obviously you want to check and make sure there's nothing else going on.
Absolutely. And so, kind of leading to that is, one of the things you could do is to check your baby's temperature, for example.
Absolutely. So, things you're going to go through your list of concerns, like, is my baby hungry? Is my baby's diaper wet? Or does my baby have a poopy or a bowel movement in the diaper? And then, another thing to really consider is that that babies can get what are called hair tourniquets, which are pieces of hair tied around toes or fingers. So if your baby's crying, obviously, constantly, you want to just check the fingers and toes, make sure nothing's tied there and hurting them.
Or if you have a male baby, even the penis as well.
Absolutely.
So we can talk a little bit about circumcision since we're kind of talking about that anatomy.
Absolutely.
So if you do choose to have your, baby circumcised, that's fine. There's nothing that's required or mandatory.
Right.
But some research has shown that by having your baby circumcised can reduce the risk of urinary tract infections, as they're older.
And there is also some research shows that it does reduce the risk of certain viruses and sexually transmitted diseases when children grow into adulthood.
So here in Northern Virginia, babies are circumcised in the hospital, and they provide you with all the instructions. But, when you do come to the pediatrician's office, that's something that we get a lot of questions about on caring for after the circumcision. And is it looking, is it healing appropriately? Which, we examine and go over with you how to care for your baby after the circumcision.
And the nice thing about circumcision in one sense is that it usually heals within a week, looks perfectly like normal skin. But in that process, it can be kind of a yellow kind of material that looks concerning, but that is actually the normal healing process.
So, right after the circumcision, don't be alarmed if it looks really raw. Sometimes there can be a little bit of bleeding that happens. And then over time it heals. And as Dr. Meyer explained, you'll notice that yellow crustiness. And then eventually within the first 1 week, it heals completely. So in that first 1 week, again, you want to be very gentle when you're cleaning that area and keeping that area clean and dry as possible. And not doing those submersion tub baths until that circumcision is completely healed.
Correct. Good. And then the other thing is just the last thing about circumcision If you choose to have your son circumcised, you want to let the obstetrician in the hospital know, because they will do it there for you in the hospital.
Absolutely. So another topic that's extremely common that we get a lot of
Yes.
phone calls about and questions about, in the office is diaper rashes, which are very
Absolutely.
common, and it has to do with the fact that your skin just, gets irritated, is exposed to the wetness, for longer periods of time, and it kind of breaks down that skin barrier.
Absolutely. And diaper rashes are super common. Unfortunately, some babies are more prone to have irritated skin than others. And if you notice your child is a baby who gets lots of diaper rashes, you may want to put on a diaper cream preventatively with each diaper change. But I would only do that if you have a child who's tendency towards diaper rashes.
And a typical diaper rash for, a baby, you'll just notice the redness on the very, superficial layer of the skin. So things that, help to prevent diaper rashes is changing the diaper frequently, cleaning the area with water, and then if your baby is going to be more prone to diaper rashes, applying that preventive diaper rash ointment. And there's a lot of effective diaper rash ointments available over the counter, things like Aquaphor, A&D, Desitin, Boudreaux's butt paste.
And just one word about that, ointments and creams really work the best, and try to avoid using any powders in the diaper area. That powder aerosolizes, and it's bad for the baby to breathe. So really you just want to stick to a cream or an ointment.
Absolutely. And just apply a thick layer. You don't want to be rubbing in too deeply, though.
Right. Correct. If you have a diaper rash that's been there more than a couple days, 2-3 days or more, it may be time for us to check that out. Little red dots can sometimes be a sign of a yeast diaper rash, and we can prescribe some medication for it, or there are sometimes some over-the-counter medicines we recommend too.
Right. Or if you notice the rash is bleeding, starts, having blisters or pus-filled sores, that's something where you want to call the pediatrician's office.
Absolutely. And then fever. So everybody's obviously very worried about fever right now anyway, but many parents, of course, worry about fever. And as a pediatrician, we worry about fever, particularly in the first 3 months of life. So a fever in the first 3 months of life could mean that the baby has a bacterial infection in their blood or their urine, or maybe in their spinal cord. So any fever in a young baby is 100.4 or higher. We recommend taking the temperature rectally, which I know sounds kind of difficult, or may not be the easiest thing to do, but it is the most accurate. If you have an ear thermometer, it may not work as well in young babies because their ears are just so small. If you have a digital thermometer, you can start under the armpit, but if it's anywhere near like 99, you want to take it rectally to confirm.
Right. And it's fairly easy to do. But again, it's the most important because it's the most accurate. So again, as Dr. Meyer mentioned, 100.4 degrees Fahrenheit, which is equivalent to 38 degrees Celsius.
Correct. That's right. And then, the thermometer, if you have a little digital, you put a little Vaseline on the tip of the thermometer, and then you stick that in the bottom and wait for it to beep.
And so, and when you bring your baby home, obviously in the hospital, the nurses will be frequently checking your baby's temperature. But once you come home, you don't need to be doing that. And your baby, will be showing signs. Being unconsolable, for example, extremely fussy, not wanting to feed, maybe being lethargic, where it's difficult for your baby to become awake or alert. So all those things is an indication where we recommend checking your baby's temperature.
And one other thing too, if your baby feels hot to you, you may want to unwrap them a bit and then wait to check the temperature, wait about a minute, because sometimes over bundling will cause the baby's temperature to go up slightly.
Absolutely. But, if your baby does have a fever, you definitely would want to call your pediatrician's office immediately. So here at Nova Pediatrics, we're always available to be able to speak to one of the providers, our nurses, and even after hours as well for emergencies.
Correct. Yep. That's one of the main reasons we're here for. Help you guys.
Absolutely. And keeping your baby safe.
Absolutely. All about safety. And speaking of safety, car seat safety, right? So in the state of Virginia, children are supposed to remain rear facing in car seats until age 2. Of course, the hospitals will not let you bring your newborn home without a car seat. And many times, if it's your first time, you want to have that car seat checked to make sure it's secure in your car.
Right. So you can, go to an authorized car seat technician. Sometimes fire departments, police stations, they have those. So that way, you can have your car seat checked beforehand to make sure that, you're comfortable with installing that car seat in your car, making sure that it fits in your car properly, and you know how to properly, work the straps and adjust the straps.
That's correct. And make sure that the car seat is in tight, is in the it's gonna not move if you were in a car accident.
Exactly. So, the reason that we have this is to protect your baby, and the way that the car seats are developed, it protects the most important part, which is the head, the spine, the neck, and back of your baby. So it kind of distributes that force if you happen to be in a car accident, to protect that baby from affecting that one part of your body.
Right. And I think one of the most common questions I get as children are getting older in rear-facing car seats is, oh, my child is getting too long. And so they may get a little long and their legs may be a little crunched. But the protection, as Dr. Tyabji was saying, is protecting that head and neck. So riding rear-facing in a car protects your spine and your head and your neck so much more. And that's why the recommendations is rear-facing until 2. And just keep in mind, in Europe, children actually are supposed to ride rear-facing until 4 or 5, which I know sounds kind of very unusual for us, but it really does keep your children safe.
So the other thing you can also look at, so, as Dr. Meyer said, in Virginia, it's at least until you're 2 years of age to be rear facing. But you can also look at the maximum weight and height limits on your car seat as well. So on the side of that car seat, you'll have a little sticker that indicates what the maximum weight and height limit is. So if your child is older than 2, but still hasn't reached that maximum weight or height, again, it's still going to be the safest to be rear facing.
That's correct.
And then again, talking about safety and protecting your baby.
Yes. We would just want to make one statement about, so we support the American Academy of Pediatrics recommendations for vaccinating babies, and we follow their schedule. And anything else you wanted to add about?
No, again, we're here to answer any questions. If you have any questions, feel free to type it in that comments box, and we'll be able to, happy to answer any questions. And if anything pops, in your mind, even after this Facebook Live event, feel free to call our office or even, post anything on our Facebook page.
Absolutely. That we're here to guide you through each step of the way. And we follow, as I said, we follow the American Academy of Pediatrics recommendations, and babies starting in the newborn period are seen every 2 to 3 months in the very beginning. So in the very beginning, we see you within 2 or 3 days of leaving the hospital, and then 2 weeks of age, 1 month, 2 months, 4, 6. And so each visit is important because babies are growing and developing so rapidly in those first few years. So we're here to kind of guide you through that.
And at each of these well checks, it's not just about, coming in for the vaccine, but also for, making sure we answer all your questions, making sure that your baby's growing appropriately, developing appropriately, and, is safe.
That's absolutely right. So a lot more goes into just a well visit. There's a lot of discussion and a lot of guidance that goes into that.
Absolutely. And it's making sure that you're comfortable at home and enjoying, that quality time with your baby.
Absolutely.
Well, thank you again. We really enjoyed talking with you today on our second Facebook Live. And we hope that you have a wonderful day, and happy Mother's Day.
Yes, happy Mother's Day.